Good afternoon, everyone. Hello, hello. My name is Tanya Hawley with HR Knowledge Source Marketing Consultant, and I'm, of course, so excited to be with you this afternoon, bringing you another edition of the Radical Edge of HR. And today we are going to discuss the COVID workplace battlefield. That's on a lot of our minds these days, so we thought it'd be a hot topic for today. So, without further ado, please welcome our subject matter expert of COVID. She knows everything about it, and she is an HR consultant with HRKS, of course, Miss Leah Garber. Welcome, Leah.
Hi, Tanya. Thanks so much. Glad to be here.
Thank you so much for joining me today. Can you just tell them a little bit about yourself before we officially get started?
Yeah, certainly. So my name is Leah Garber. I'm a consultant with HR Knowledge Source. My expertise is in human resources, compliance, and operational improvements. And several months ago, I was asked by the HRKS team to be the subject matter expert on COVID. So I'm over the summer and the last several months, almost 6 or 7 months actually, I've spent quite a bit of time investigating policies, recommendations, best practices around COVID, and I'm excited to share what I know with you.
Wonderful. And we are excited for you to share what you know because everybody is, I think, eating, drinking, and sleeping COVID right now. And that's just the buzz for almost too long, I would say. So, at least over a year now, that has been the topic and the issues going on with everyone. So, everyone, we're going to address some of those and just talk about them a little bit. If you have any questions or comments, please feel free to post them, and I'll be happy to read them to Leah for you, and we'll be happy to answer them. If we don't have an answer, we'll get one for you. And tell us hello. Let us know you're out there if you're watching. So we're going to go ahead and get started. So, Leah, the first question I have for you is one that a lot of people ask and has been discussed a whole lot. And that is, can employers require employees to receive the COVID-19 vaccine?
Yeah, good question. Generally, yes, employers can mandate the COVID vaccine for employees without running into anti-discrimination laws. There are a couple of states that are working on mandates to prohibit employers from requiring a mandate or requiring to see the vaccine record of their employees. At this point, I think it's Montana and North Dakota. I checked yesterday, and those are the states that, if you're in those states, take a second look. I know that Thursday of last week, there was an update. The president announced that he's partnering with OSHA to put out a new vaccine mandate that federal employers will be required to require the vaccine of their employees, and employers over 100 employees will be required to require the vaccine or require weekly testing. That policy hasn't been published yet. Federal employees are required to have the vaccine, but for private employers, that 100 or more employee rule, it hasn't been published. However, it's something for employers of greater than 100 employees to start thinking about. And with a mandate comes the obligation to consider accommodations for both medical disability reasons and sincerely held religious beliefs.
Okay. And so what are some of the possible accommodations and how does that actual process work?
Yeah, so the accommodation process, first is an employer has to have a documented process for the accommodation. So if I'm the employee and I think maybe I need an accommodation, I need to know how I go about requesting that. So first, a documented procedure telling the employee who they go to, what kind of paperwork is required, a very formal documented process so that employees know where to go. The second step would be to review the job. So every employee, every job at every company is going to be different. And we need to know the requirements of the role before we can start considering accommodations. The third step is going to be the interactive process. And this is really critical for HR professionals who manage FMLA and Americans with disability issues in the workplace. They're going to know this process really well. But it's when the employer and the employee sit down and talk about what kind of accommodations are reasonable for this employee. And like I said before, every individual at every company holding every position is going to be different. Once you've seen one accommodation, you've seen one accommodation. They're all very individualized.
Oh, okay.
Yeah. Then determination of the qualification. Does the employee fit the qualification for medical or disability reason or that sincerely held religious belief? And then the final decision and communication to the employee, formally telling the employee that we are allowing the accommodation or we're not, and here's why.
Okay, great. Thank you for that.
Yeah.
So there's probably some employers watching, and what should an employer consider before they actually make that vaccine mandated for their employees? What considerations should they have?
Sure. So, like I stated earlier, the proposed vaccine mandate is not in place yet.
Mm-hmm.
So, the employer still has the option to mandate or not mandate. A couple of the considerations that I've thought about and talked to business leaders about is first reviewing your business needs. How close do employees work together? Do you have 10 employees in one room all the time and you're not going to be able to separate them? Are your employees interacting with the public all the time, customers or vendors?
Okay.
Maybe it'll be a good idea to mandate the vaccine in that case. But if all of the employees are always 6 feet apart or employees work remotely most of the time, maybe it's not the business need to mandate the vaccine.
Okay.
Second is reviewing your manpower. So say 95% of your employees are already vaccinated. Is it really necessary to create a mandate to manage 5% of your employees? So looking at your current manpower and understanding their vaccine status. Then are you ready to terminate employees? If you mandate the vaccine and an employee says, nope, I'm not getting it, are you ready to terminate that employee? It could be your best employee, it could be your worst employee, but are you ready to follow through on that policy?
Oh, wow. That's really that can be very deep. If it goes that far, if it goes that far, a lot of things to consider. I hadn't thought about that. You really got to consider all of those things when you're making that decision, apparently. So there's a lot of things to consider. I wouldn't have thought of that. I guess because I'm not the person that would hire or fire someone. So
Sure.
Thank you for that. That's awesome. And I guess it sounds like it's just the decision is just, it could be a variety of decisions based on the company or based on the business leader and what type of business they have.
Yeah, I think that businesses fall in 3 categories right now. The first is that we believe we are here to help get this vaccine out, that it's part of our responsibility as the company to do that. Second is the employer who encourages it but doesn't require it. And third, the employer who doesn't take a stance. You can get it or you don't get it. That's the employee's responsibility or decision to make.
Wow. And that's going to be quite interesting in our country, because I know there's all 3 of them are all over. So and how they affect each other, people doing business with other people, with other businesses.
Right. And even if this mandate through OSHA comes through, there's still a lot of employers with less than 100 employees that this decision will still be up to them.
Wow. Okay, well, let's move along. That was great. Thank you for sharing that. Some great information there. So here's a big one, because people are like, this is my right, my vaccines are my business. So does an employer can they require to review vaccine records? Do they have the right to people's vaccine records?
Yeah. So an employer can require an employee to present their vaccine card or a note from the doctor that says they were vaccinated and here's their last date of vaccination. However, they can't ask for any more information than that. We don't want to know why you didn't receive it if you didn't, or why you didn't receive the second one if you didn't, or why you chose to get the vaccine, or any additional medical information. Just the card or a notification that there was a vaccine or not. And then we need to keep in mind as employers that that card or the knowledge of the employee receiving the vaccine is private medical information. So it's not something that we can put into the personnel file or with I-9s or leave on our desk to review at another time. It goes straight into the employee's medical file where you keep FMLA documents or workers' compensation documents. So that's private medical information. And another piece of that is we can't post a list of employees who are or are not vaccinated. Just because we're not sharing the document itself, that would still be sharing medical information. So it's a private, confidential information.
So how would they go about actually telling other employees that they've been near someone that has COVID? I assume they're going to have to somehow notify them without giving the name or information of who the actual person is.
Yeah, so that's a really tricky situation. And lots of employees use their deductive reasoning to figure out who the employee is. But as the employer, we're not allowed to say that employee. I'm not allowed to say, hey, everyone, Tanya tested positive for COVID last week. And if you've been in contact with her for the last 3 days, you need to go get tested yourself. I'm recommending that employers have a template letter ready to go. Something along the lines of, dear employee, you have been exposed to a coworker who tested positive for COVID, and they were in contact with you between the dates of XYZ and XYZ. You need to quarantine for the next 14 days. And if you have testing requirements, get the test. But sharing with them that they could have potentially been exposed, but not sharing the employee's name.
Okay. And I have received letters like that from the school system, from my children. A generic letter that I get like every day. So I get quite often because of the school, but they have to send those apparently the same information, exactly what you're saying. It's a generic letter. And every time, and you can imagine in a classroom, there's a lot of kids. And if you're in that classroom, that letter has to go out and it's just very generic. So I know exactly what you're referring to. And that's interesting because if the business is huge and you're around a lot of people, you may get more letters, just giving the information, where it might just be a couple in the office. You can probably figure out who it is as well
right.
from that. So that's, I'm very familiar with those letters. So I'm sorry, were you going to say something else?
Yeah, I was going to say that a thought came to my mind is how do you know which employees to send that to? Because in a school, you have a classroom of students, so you send it to the parents of those students in the classroom. But as the employer, gosh, you have everyone walking in and out of the office every day. So my recommendation would be to, when you receive the communication from the employee who tested positive, you ask that employee to identify employees that they've been in contact with at the workplace. So that's how you're going to do your contact tracing, is by speaking with the individual who tested positive or was potentially exposed, to get a list of employees that you need to reach out to. Okay.
Very good. Thank you for that. Got a couple more questions I have on our list here. So, an employee is required to quarantine because they were exposed, or what we were just speaking of, to someone that has COVID. What are their leave options?
Yeah, so some of them are
quarantine, or do they get paid? Or
yeah, some of them are across the board, and some of them depend on company policy, the policies that companies already have in place. And some companies have put policies in place because of COVID and the quarantine that's very different from any other situation that we've ever been in. So the first one that comes to mind is remote work. If an employee can work remotely for those 14 days, allow that. If they can't, if you have someone who's on the line all the time or on a manufacturing line and you can't really do that from home, then you'd look into one of the other options. But remote work is probably the number one option. Then sick time and or PTO, most companies offer that to their employees. So employees can use that to take time off. FMLA, if the employer is greater than 50 employees and it's a qualifying event, which means that they are ill or taking care of a dependent who is ill. If it's a qualifying event, they could apply for FMLA and use that unpaid time off. Some companies are implementing a quarantine leave where employees are paid 100% or a partial amount of their salary for the 14-day quarantine. Also, some companies are using short-term disability. If you talk to your provider, your insurance provider, sometimes you can waive that coverage or waive the waiting period for that coverage and start using short-term disability, or even workers' compensation. If the employer is requiring the vaccine and the employee received the vaccine because of that, not out of their personal choice, but the employer is requiring it and they took the vaccine and now they're having a bad reaction to it, workers' compensation could come into play. Also, the Family First Coronavirus Response Act leave. I know that is a mouthful. That was something that was put into place last year. That was put into place last year, and it required employers to offer 2 weeks, 14 days of paid leave to employees for this quarantine time. It's not required anymore, but some employers are still offering it, and the employer can still get a tax credit until the end of this month, September, if they offer that to employees. So there are a lot of options to think about.
It's almost like we have created a whole new world, business world, around COVID or world. I would just say world, not just business, just our whole, everything has changed from a year and a half ago till now. Even things you were saying, they got to come up with new ways to address this and to give people the leave that they need and just all kind of things. Um, and as I said, a year and a half ago, most people were working in their employment job at their building, in their workplace. Now, a lot of people, well, they went to remote. So many people were remote. And now we're looking at a lot of them going back. So many people are back in their workspace or going back. And it's a whole new environment, or it's a cultural environment around COVID. So is there any workplace etiquette that you can suggest or talk about just to help those that are returning, or things that might help them?
Yeah. So on the employer side, one of the key things is maintaining or even upping your cleaning game. So I
Okay.
know that
Mm,
at my previous employers, the janitor came in once a week or maybe twice a week and cleaned everything. They took out the trash and wiped down counters, and
right.
upping that game a bit. Janitors come in every day or every other day, and they're wiping down, especially community spaces, the
Yes.
doorknobs and the kitchen
Yes.
area and the restroom and the conference rooms if those are
Right.
being used. So, upping the cleaning game and offering cleaning supplies to employees. So, lots of employers are offering the hand sanitizer,
Right.
but some employers also have Lysol sitting at the front desk that you can use, or Clorox. Keeping in mind that a safety issue with that is you can't just introduce a new chemical to your workplace. It
Mm,
may require a safety data sheet and some training on how to use that and how to handle it if it's spilled. But offering cleaning supplies to your employees so that they can clean their own spaces as they want to as well.
wow. And we didn't think about these things before. You didn't think
Right.
about wiping off a doorknob before
Right.
COVID. We didn't think about that. Even phones, if people may share a phone, those kind of things, pencils, or the pen you use on the keypad or the pen pad when you use your credit card, and just all those types of things we didn't think of before. It's just a whole different environment now.
Right. I remember seeing the wash your hands signs in restaurants and maybe
Yes,
grocery stores, but now those are showing up in offices too. How to
everywhere.
wash your hands, the happy birthday song while you're scrubbing. Yeah,
Yes.
the rules on how to do that. It's showing up everywhere, not just the places that we're used to seeing those instructions.
Yes, there's a lot of people singing in the bathrooms now. So we didn't get that
Right,
before.
right.
Yes, are there any changes? We have this new variant, Leah. So is there anything different from a year and a half ago to now, practices or anything that has to do, with COVID, the new COVID variant, that we should know about or address in regard to practices or anything of that nature?
Yeah, I wouldn't say there's anything different. I know that when the mask mandate was in place and everyone was working remotely, we were really cautious. Employers were really cautious and upped their cleaning game. And
Mhm.
over the last couple of months, well, before this Delta variant, so before the last month, a couple of months prior to that, I know that we
Mhm.
became pretty lax. Employees weren't required to wear masks
Mhm.
anymore if they were vaccinated. I know that my hand cleaning procedures faltered a bit. I wasn't
Practices.
singing the entire happy birthday song anymore. But
Right.
coming back to where we were a year ago, re-implementing the mask rule, re-implementing the hand sanitizers and the washing and the cleaning. So I don't think there's anything different. We're just back to being more stringent
Wow.
on our procedures.
So you think, based on what you said, what I'm picking up is that people, we got almost comfortable or used to it. It started to become the norm almost. And
Right.
then it got a little better. So we kind of slacked off. With some of us did, we got a little comfortable. We don't have to wear masks as much, perhaps. So I'm not using that sanitizer as much as I did before. And
Exactly.
now, from what you're saying, the temperature has gone back up. So we're some of us are paying attention and we're wearing a mask a little bit more. So we're kind of shifting again.
Right. I'm carrying hand sanitizer in my purse again, and I've got a mask in my car, in my purse, in a drawer
Me
here at the
too.
house. They're coming
Yes.
back. Mhm.
Yeah. So it's interesting. And hopefully, it'll level off soon and we'll be back to a new better norm, I hope.
Yeah, I certainly hope so.
Yes, me too. So, Leah, we're just about out of time. We're just about finished. One last question for you. So, what COVID best practices do you want listeners or everyone watching to walk away with today?
Sure. So employers, number one is that employers need to have a policy in place around coronavirus, or I'm calling it the infectious disease control policy, like an
Yes.
overarching, and I've been putting an addendum inside for coronavirus, just in case
Mhm.
this ever happens with something else again. We have a policy around it. So the first thing that I like inside of that policy is the expectation of change. I know that when we create policies, we hope that that will be the policy. It's rolled out, we train
Right.
it, and that's what we will continue with. But things are changing so often. The president just made an announcement last week. Who knows when OSHA will implement, if OSHA will implement that rule this week. The mask mandates come back and forth. So the expectation of change is really important to put into that policy, that we're
Mhm.
keeping up with the CDC, we're keeping up with the World Health Organization or whatever other organizations you're keeping up with. And this policy is really a living and breathing document that will change with the rules that change. And then setting out the expectations. Do you require the vaccine? Do you require weekly testing? Do you do temperature screenings on employees when they come in? Or do you do the questionnaire that has the 3 questions about, do you have any symptoms, and do you have a
Mhm.
temperature over the last 24 hours? Are you doing those things? Those things should be very much spelled out in your policy. The second is to monitor your workforce for signs of mental health struggles.
Oh, yes.
This is a really tough time for a lot of people. We've been missing our friends, we've been missing our colleagues. I know that I personally have been working from home for the last 6 months, and I enjoy getting on Zoom, but giving someone a hug or shaking their hand, those
Mm.
things, it's hurting my heart to not be able to do those things.
Yes. Yes.
So, employers, not that you become your employee's therapist, but you can guide them in directions when you notice that something might be going wrong. Most employers have an employee assistance program, an EAP, through their insurance, and you can direct employees to that. That's usually telephone or web counseling for anything that the employee is going through. Wellness initiatives, positivity, maybe meditation or yoga, to keep people's hearts light, positive, how to relax yourself when you're feeling
Mhm. Mhm.
angered or when you're feeling frustrated, and fun and social initiatives, how to get your employees together, even virtually, so that you keep those connections. That's really important for employee
Yes.
mental
That's
wellness.
good.
And then
That's
the third is regular communications. So don't let your employees be afraid that you don't know what's going next. I know that
mm.
I'm recommending that employers talk to their employees once a week. Put out a bulletin, or your HR manager maybe creates a YouTube video mentioning that here's where we're at. Nothing has changed over the last week. Our employees are still working remotely. Here's a fun way to get outside and take a walk, or here's some pictures of some walks of our employees last week. So we're sharing the information about our COVID policy, and if there's any changes, we're sharing a little personal thing to make people excited or positive,
Yes, that's
just
good.
so that employees aren't worried about what's coming next. You keep them informed instead
Yes.
of them having to ask you questions all the time.
Great. Those are great ideas. Well, everyone, you see now why Leah is our subject matter expert on COVID. She knows all about it. Thank you so much, Leah. That was some great information. We hope you all enjoyed it. We hope you learned something today. Make sure you follow us, HR Knowledge Source, on all of our social media outlets and platforms, Facebook, LinkedIn, Instagram. We're all over the place. So make sure you follow us. If you have any further questions, or comments, feel free. If you're looking at this later, you can still comment or look us up on our website, hrknowledgesource.com, and contact us for all your HR needs as well. Because HRKS, we know HR. Thank you, Leah. You've been wonderful today. Thank you for sharing all that wonderful knowledge with us. We appreciate you.
Thank you for having me.
You're welcome. Everybody, have a great rest of your day, and we'll see you next time on the Radical Edge of HR.
Bye-bye.
Bye-bye.